Hi everybody, this is a video about treating mycoplasma. As per usual, nothing that I'm saying here on social media should be construed as medical advice. This is for informational purposes only, and please talk to your doctor if you need medical advice. So I posted a video, I think a few months ago, about treating mycoplasma using herbs and mentioned some of my favorite herbs, herbs like cryptolepis and alcornia and isatis and seta, Chinese skullcap, Japanese knotweed. These herbs are really great. They have a broad spectrum of activity. They're also good against the Lyme bacteria. They're good against babesia. Some of them have some antiviral activity as well. They have an activity against mycoplasma as indicated here. So I talk about these herbs pretty commonly, but somebody posted a question saying, if I can't access these herbs, are there others that I could use instead, like more common ones, like maybe olive leaf extract or turmeric? So thank you for the question. That's a good question. And yeah, being able to access the right types of treatment is so important. Now, if folks are in North America, generally speaking, to my knowledge, you can access these herbs. And I say that because I have many patients in Canada, of course, and then I also consult on patients' cases in the US, amongst other places as well. And generally speaking, they can access these herbs. Unfortunately, some herbal dispensaries charge quite a lot for these types of herbs. So finding like an affordable or cost-effective option can sometimes be a little bit tricky. We thankfully have a good line on, well-priced herbs, so it's not something that's a big barrier for our patients, but for some, in some cases, it can be. So in terms of using other herbs in lieu of some of these, fancier or lesser known herbs that I keep talking about, the answer is maybe. I quite frankly don't have much experience using many other types of herbs because these are the ones I've just used for many years now. They work well, we've had access to them, and there just hasn't been kind of, if it's not broken, don't fix it. With that being said, if I suddenly found myself in a world without those herbs that I just listed off, what would I recommend for my patients suffering from chronic infections? The herbs that I would be thinking of would be, or what I would kind of default to, and quite frankly, what I have defaulted to in some cases when the herbs that I prefer to use are just not an option for patients for some reason because they flare from them too much, or anyways, various rare reasons, but reasons nonetheless where sometimes I can't use these herbs with patients. Another good option to consider for my patients has been using essential oils. Now, when it comes to using essential oils, you have to be careful with those. The clinician who's prescribing them needs to be well versed in which ones are safe to use and what forms are safe to use. Because these to work, they have to be, or they I don't believe that they would work unless they're administered orally, and so we have to be careful with that. But they've done a couple of studies actually showing that, at least in petri dishes, these virtually any essential oil that you can name has been shown to have a significant antimicrobial effect against the Lyme disease-causing bacteria, Borrelia burgdorferi. And in my clinical experience, I've found it to be effective against other types of infections too. Taking oral essential oils is a bit tricky because sometimes they can be hard on the stomach. Sometimes you might be inadvertently treating gut microbes as well at the same time. So it's a little bit of a double-edged sword, but that is one more common option. Like, of course, easy to find oil of oregano, thyme oil, clove oil, things like that. Other herbs, like, the ones mentioned in the question, like turmeric or olive leaf extract, I really haven't, I would not have a high level of confidence that turmeric would be an effective systemic antimicrobial. Olive leaf extract, I know, is used as an antimicrobial. I believe it's more commonly used as an antiviral, but again, I just don't have the clinical experience with that to be able to speak to it from direct firsthand experience. Wormwood, which is a fairly common herb, that does have some good antimicrobial effect, particularly against babesia, which is a more common one. There are some petri dish studies showing that black walnut extract, which is also fairly common, has some anti-Borrelia activity, although in clinical practice I haven't really seen it help. There's some petri dish evidence that stevia, which is widely available, has some anti-Borrelia activity, although in clinical practice it's been quite rare that I've seen that make a big clinical difference. So there are some more common herbs, but it's just in terms of how effective. Angiographis is one that's a little more on the common end of the spectrum that has some anti-Lyme activity. So there are some more common herbs out there besides the one I mentioned. I'm certainly not implying that the herbs that I have mentioned in previous videos about Mycoplasma or other systemic infections are the only options available. They're just the ones that I've seen work the best over time. I've worked with a number of different formulas over the course of time, and these are the ones that have stood the test of time for me the best. So thank you for the question. I hope this answers your question. If you or anyone else has any further questions about this topic, please post in the comment section below. And if there's questions about anything else health related, especially within the realm of complex chronic illness, then please post in the comment section below, and I'll do my best to answer as soon as I can.